Welcome to the latest ECIST podcast. I'm Jacqui Scrace and I'm the Interim Assistant Director of Nursing for Children and Young People across the South West region in NHS England, and I'm absolutely delighted to be joined by Lisa today. Lisa, do you want to introduce yourself?
Hello, Jacqui. Jacqui's my mentor, and I'd very much like to thank her for this opportunity to have a chat. My name is Lisa Gavin, and I am the Clinical Service Manager for the Inclusion Health team in Surrey. So I'm a health visitor by background, and I lead a team of a skill mix of nurses that work across the whole geography of Surrey, and we deal with outreach for vulnerable groups of people.
Fabulous. Thanks, Lisa. Absolutely lovely to have you here today. Can you tell me a bit, Lisa, about your community nursing role?
Yes, it's quite interesting because I've come from a background as a nurse and a health visitor, but the role has really grown and developed as the various projects we've taken on have grown and developed. So it started from my background was working as a health visitor in a homeless health team and then leading that team in the east of Surrey. But through various reiterations of the structures within the teams, my role was then made head of homelessness in Surrey, but with no team at that point. So what we had done is approached the ICB, well, the forebears of the ICB, which was then the CCGs, for some funding to do some outreach work to build on what we'd found with the health inequalities for gypsies and travellers in our local patch. Mm-hmm. So that's how it kind of has really grown from there. So then there was the outcomes were really quite dramatic when we looked at the health inequalities and what was going on in these communities. We saw that what we'd seen locally was reflected both in the research nationally about the outcomes for gypsies and travellers, but also that was our experience with other groups in different types of housing, on sites, in houses, unauthorised encampments, all that sort of thing. So on the basis of the outcomes that we were able to demonstrate, we then applied for a second bid for homeless families, and we were granted that. So the team grew a bit more, and then the pandemic hit, and then after the pandemic, then the asylum seeker hotels were opened up in Surrey, which was completely new for Surrey. Mm-hmm. So those vulnerable cohorts of people were sort of absorbed into the work that we were doing.
Sure. It's really interesting work and so important, Lisa, and I think it really fits in with the wider agenda, doesn't it, around inequalities in access to healthcare as well, and particularly around children and young people as well in terms of that healthcare inequalities. So really important, and I think it leads quite nicely into what I wanted to ask you about your work being recognised. So as a team, you've been recognised recently, haven't you? Tell us a bit about that.
Yes, thank you. And yes, I think as all nurses, we're quite uncomfortable about acknowledging awards, but I think this is really about the work that has been quite creative, and I know the word innovative is used quite a lot, but actually we'd have to be quite agile at looking at our populations and how do we improve access to healthcare, mm-hmm. and what works and what are the barriers and what actually is causing many of these health inequalities that we see. So we were very proud as a team to be awarded the excellence in primary care from the Burdett Trust this year, and actually we were even more thrilled that we were overall winners against all of the other categories that night. So that was wonderful, and I think what was being recognised that actually even with the limited resources that we have in the NHS at the moment, the pressures on waiting lists, the pressures on staff recruitment and retention, the sort of the huge extra demands because of the pandemic and post-pandemic, because of the cost of living crisis and how that's actually affecting people, that we know that the demand on services has just grown and is really difficult to meet. So I think the fact that a small team can actually sort of punch above its weight in a way by working in a slightly different way was being recognised, and a lot of that was about being very collaborative. So we're only a small team. There are about 10 in the team, give and take. We have people that move on, and when I tend to really work hard to develop my staff. So the flip side of that is then that they go on to do other jobs and other roles as they grow. We had a a nursery nurse this very week who asked me for a reference. She's just qualified as a social worker. That's fabulous.
Wow.
But actually that means that constant sort of cycle of recruiting is important.
Mm.
In a way, I look at it in a positive way, to think of that as upskilling, not just our immediate workforce, but also talking about inclusion health, actually seeing that in so many different contexts, whether we're talking about acute services in hospital, whether we're talking about a community, whether we're talking about primary care in GP practices, there's a lot that nurses can do to actually address health inequalities, and that we need to really look at our populations, not as the others, the asylum seekers who are taking away from our resources or creating greater pressures on the NHS, but these are our populations. These are they may have status that at the moment they might not be entitled to all of the benefits of being a UK resident, but we know that most of them will be, and so we need to welcome these people and see them as part of our population, as we are, UK population. And I think there are many benefits for that. So the work around inclusion health is looking at what those barriers are, and some of it can be language, some of it can be literacy, some of it can be whether people have money to get on a bus to get to a hospital appointment, whether they even can read the messages or the letters to know that they need to go to a hospital appointment, different cultural aspects, because we've seen a lot in the Afghan hotels that a lot of the women there have been really puzzled, and it took us a while to work out why they refused to go to the hospital except for their scans, because in many countries of origin people might not routinely have maternity care before they have their babies, and they understand a midwife is the person that actually delivers your baby. So they were quite puzzled by why we kept wanting to go for appointments, and not actually understanding why it was so important, and the education, and why the babies, the size of the baby being measured was important, and all the other indicators that are really important to reduce risk. When we understood that, we were then able to explain to them that this wasn't a needless procedure, but why it was vitally important. And that's also an opportunity to educate people about reducing risk, about healthy eating, about managing what they can within their challenging environments. And this is equally important whether we're talking about gypsies and travellers, people who might not have a secure housing situation for whatever reason, either from those groups or families that are homeless, maybe living in a travel lodge, and we're seeing more and more of those families, but also the asylum seekers and refugees too. And I think if I was asked what is the significant factor that all those groups, all marginalised groups, including other groups that we do advocate for, such as those with learning difficulties, people from Black or other ethnic minorities, that there's a huge amount of trauma, there's a huge amount of lived experience of discrimination in various forms, but also very traumatic backgrounds before they've come into our service. And I think it's really important that we recognise that, because those interactions we have are precious. It's an opportunity not just to be really efficient and think more widely than whatever we happen to be doing, a new birth visit or an antenatal contact or a developmental assessment or anything like that, but actually thinking about people's mental health, the cultural implications from where they've come from, which is why we might think about things like FGM, whether they've been trafficked. And it's about that professional curiosity, which is just so vital, because we could see somebody in one setting and you could have professionals who are just doing their job as they're expected to do, but if they don't actually use as an opportunity to ask other questions around risks of domestic abuse, around other how they're managing financially, that sort of thing, then these people will continue to fall through the net. They will continue to not get an equitable service from the NHS, and that can be any one of us. It could be a sonographer taking an ultrasound for a pregnant woman and noticing bruises, for example. And I think it's giving our professionals the confidence to actually see that individual in that moment as more than a chore to get through.
Yeah, absolutely right. And I think what you're talking about and what you're describing is really important, because these population groups will reach everybody working across health, education and social care, won't they? So it's how well informed we are. Yeah, I think it's really, really important. You spoke a little bit about your innovative approach. So I'd really like to hear a bit more about that, but also about your collaboration and integration in the team and who is part of your team.
Okay, so maybe I'll start with the team first. That's probably the most straightforward.
Yeah.
So what we have found is that we needed to create some roles, or I felt we needed to create new roles, because we're a small clinical team. We have health visitors. We've had in the past a school nurse. We've got nursery nurses, but we also we've looked at the needs in this team and created additional roles. So we have a community engagement officer, a band 5 post, which I looked at lots of different other band 5 non-clinical roles within the NHS structure, and realised that actually we could benefit from having people who could do a lot of the engagement, the stuff that is really important to make things work and to help people access healthcare, not just registering people with a GP, but actually liaising with the GP surgery when people are saying, no, the list is full, we can't do this, or actually not understanding that somebody can't get to an appointment unless transport's been arranged if they're in a hotel, that sort of thing. So it's around the advocacy, but also some really practical stuff that up until recently, until we had these roles, the health visitors and nurses were very much struggling to do as part of this, because we see the need, we respond to the need. But that's really helped us to actually free up as much clinical time from this small team as we possibly can. So today, for example, our engagement officer has been working with a local charity in a hotel that supports one of the hotels to get bus passes for 2 young girls who were going to start college, and they didn't have any money, and the mothers don't have any benefits or anything because these people are still in the asylum process. So navigating the various systems to actually advocate for people, because we know it's more than just whether that child or young person can get to college. It's about their mental health, it's about their future, it's about their education, and the mental health is part of what we sort of look at. So that's some of the innovative stuff that we like to do. So that's really important as far as we're concerned, looking at the wider picture of people's environment and where they live, and what can we do, particularly working closely with primary care colleagues, and that's very important. That collaborative approach is extremely important. I'll talk about collaboration a bit in a moment. I'll come back to that. But as far as the innovative approach, there are many things. If we see an opportunity, we really run with it. So one of the things that has been an absolute joy is that in the hotels, the people, anybody who works with asylum seekers in hotels will know that the food is a big issue, huge issue. People are very unhappy with the food. It's usually provided by contract with outside contractors, and it comes in all of our hotels. The families and the single people are not allowed to use the dining room, so they have to collect paper bags with the takeaway food that arrives, and it's very boring. They say it's very spicy. It tends to be curries, which again, I don't know if it's an accidental, but it feels as though it's sort of an othering, a judgment that actually everybody, because they're foreigners, will eat curry, and many of people from all over the world actually don't like the food. It's the nutritional content is poor. We've found that we're seeing children in hotels who are having delayed development because the food that's provided for as a sort of a weaning food once they're off breastfeeding or milk tends to be the pouches, the highly sugared fruit pouches. And so children are eating this slop and they can't eat the spicy curries. And then we're seeing developmental delays around speech. We're seeing a lot of problems with decay of teeth. So we run monthly clinics in all of the hotels, and that's a really good opportunity for us to look at a wider public health response to what we find. We can manage any sort of emerging needs. We can look at things like follow-ups for pregnant women, following up new babies, that sort of thing. And in those clinics, we very much take the old-fashioned cradle to grave approach with health visiting, rather than looking just at 0 to 5s or young children. So we're very happy to see older people if they come to us with various health concerns, and advocate for them, help them get to where they need to be whatever the system, whether we're talking about primary care or hospital appointments and that sort of thing. We do a lot of negotiating with the hotel staff to make sure that people do get information about where they need to go and how to navigate the NHS, and we tend to use that real public health approach. So, for example, we talk about dental health. We have a rolling program where we talk about safety. We explain things like the road rules in the UK, not in detail, but about how it's not actually safe for children to be riding bikes in a hotel car park if it's shared with a pub, that sort of thing. We look at the environment that they're in and the risks in the hotel rooms, and talk about obviously things like safe sleep, that sort of thing. But more widely, I touched on some of the issues that we were seeing with children with dental problems and food refusal, and issues around children actually having to eat school meals when they go to school, because these people have now been for over 2 years in hotels, a lot of them, and from their weaning period, they've been only able to have the sort of sloppy food pouches, which are very high in sugar, and so their children haven't learned to chew proper food because they don't eat the spicy curry foods that are often delivered. So that's become a real problem. So we talk to their parents about the importance of eating and chewing, and that we're seeing some speech delays because children are actually not learning to chew as well as the dental problems. So we're using that as an opportunity to educate the families about what they should be eating, and a lot of advocacy to try and get additional things like fruit and vegetables brought in. Again, for pregnant women, a lot of the pregnant women complain that they can't eat the food because it's too spicy, and if they're feeling unwell, it's increasing their nausea. So out of this came one of the innovations that we've been really thrilled to see absolutely thrive, and that's about the community kitchen. So I looked at all of these issues, and Surrey County Council came to me and said, we have a very small pot of money which we need to use up by March next year for the well-being of asylum seekers. Lisa, what should we do with it?
You're
and
just the person.
I thought of a million things, but I thought the one thing, if we asked asylum seekers, and we went out and did a survey and said to them, if we could change one small thing for you right now in the hotel, what would that be? And they, without exception, I think maybe there were one or two things that said, get me a nicer bed or something like that. But everybody else said the food. And I was expecting that. So I thought, well, this is a real opportunity. And so we started this project. Again, on a wing and a prayer, but we looked at what sort of skills people had, asked people if they'd be interested, if we could start up a community kitchen, would they be interested in wanting to cook? Would they be interested as wanting to contribute or support? Or would they be interested in just coming along and having a nice meal that was cooked for them by other people in the hotel? And we have waiting lists every month. So what we try to do is we concentrate on one culture for that month, and the people there choose what the menu is, and they have a look. They look at they look at all of the information that they decide what they'd like to cook basically, and then we go away. They give us a list of ingredients, and then we support that. So what we did is our lovely, I was talking about our engagement officer before. This is exactly the sort of thing that really supports what the clinical staff are doing. And she went out and started sourcing places that were within a walkable distance to the various hotels where they had a suitable kitchen. And once we had the kitchen and the support of, sometimes it was church halls or village halls of the local community who would help and support us, the voluntary agencies there. And people are just, again, enthusiastically supporting us, which has been wonderful.
It's the power of the community, isn't it?
Yes.
It's amazing.
It's fabulous, and it is untapped in many ways. And I think, we have to be careful that we don't depend on voluntary sector to do things that we should be doing. But actually, on the flip side of that is we need to collaborate and use this community resource, because after all, these people are living in these communities. They're their community just
Absolutely
as much.
Right.
And I think that's really important. It's really important about integration. It's about celebration. So we started by asking people to think back, and this is where the mental health bit comes in as well. I wanted to make it have a focus of not just all of the other obvious nutritional benefits and social benefits and all that sort of thing, but to look back to happy memories and to look forward to employability. So we've done two things there. So looking back, we ask people, everybody now, we ask them when, as part of our health assessment. So it's a sort of connecting with positive memories. And we know that from a mental health perspective, that shuts down some of the fight or flight. Giving people a task to do something, again, is part of this approach. So we say to them, when you were back in your home country, can you tell me about a time when you would celebrate with food, and what would you cook? What would you like to cook, and what would be your sort of celebratory meal? And we found that people were quite surprised. It wasn't what they were expecting as part of their health assessment, but actually we explained about how connecting with happy memories and thoughts of family and that sort of thing after all the trauma that people have experienced can be a really helpful therapeutic thing to do. And then the next bit was to say, would you mind writing a recipe for us? And we'd love to collect your recipes, and either we can use them for cooking, or you can come and cook, or we're thinking about maybe collecting these for a recipe book. Because the first time I saw a long list of ingredients in a beautiful script of Urdu, I think it was, I thought, wow, this is incredible. Why don't we capture this? Because then we can use this as a sort of a form of education to the wider public about what a huge and valuable resource our asylum seekers are, what skills they come with, what they have to contribute to the richness of our society. And that's counter to the very negative narrative that we do hear about asylum seekers just taking all our resources and being a drain on the public purse. So, and that's the truth of it, actually. They are hugely resilient and skilled people who've experienced unimaginable traumas. And whether we're talking about women who've been sex trafficked, and we're doing a lot of work around that with Stop the Traffic and other organisations, or whether they're people who've fled war zones, human rights activists, we've so many amazing stories. So the community kitchens have taken off. What we do is, as far as the employability, our engagement officer will sit down and help them to complete hygiene certificates so that they're cooking safely. And we need to have at least one or two people amongst the people who are cooking who've completed that. And that's quite a laborious process of translating that into the language that the person speaks. And some people may not have literacy in their country of origin. They may speak a language, but they might not actually even be able to read it. So we've had to be quite creative and sensitive to what people's abilities and needs are and what they're comfortable with. But we make sure, for sort of, I suppose, health and safety reasons, that we're actually really confident that people know how to cook safely. And so the last thing we want is everybody in the hotel to end up with food poisoning because we've got a little bit excited. So it's an absolutely joyous occasion. Our engagement officer and I go to all of the sessions, but our plan is to hand it over to the community sector and the groups that are supporting us as we go forward, and to the asylum seekers themselves. They cook. We've got somebody who's an artist, an El Salvadorian man who's from the indigenous community in El Salvador, and he's going to design some logos for aprons that we're going to use in all of the kitchens.
Wow.
He's a fabulous artist and creates all these amazing things out of anything he can find, even tin cans, which is fabulous, but also beautiful paintings on any surface he can find. So things like that. We're using the skills and abilities of people. We're inviting them to tell us what they think they might be able to contribute. And I think people are just running with it because it's such a wonderful opportunity for them to get out of their hotel rooms and feel as though they're actually able to do something with some agency in a situation where they feel helpless and they have so little choice and agency. And what better to choose what food you're going to eat.
Yeah, and how fabulous they get a qualification at the end of it, and you're thinking about the sustainability of the service as well, but then they can all sit down and enjoy a meal together. I love that as a family and as a community. And that's normal stuff, isn't it? It's normal stuff that we often take for granted.
And it is an absolute joy. So we make a real occasion of it. So when we sit down, we use tablecloths, we have flowers, We have music playing for whatever the culture is that people are cooking from. And the people who are cooking will cook for everybody, all nationalities. People just we have a sign-up sheet so that we know when, and it's roughly 40 odd people there every month. We're trying to make it, they've asked if they could make it more often actually, and subject to funds, we're going to do that. And if we can get it up and running, then we'd like to do it. I mean, I'd like to do it every day if we could, but actually that's not really feasible. And I don't want to sort of we're relying on the generosity of the village halls and church halls who are providing the venues and things. But actually, if we could even do it twice a month or even eventually once a week, that would be fabulous. And it's to see people who we've been worried about their mental health, they've been depressed, they've been disclosing all sorts of things to us, to actually see them laughing, sitting together as a community, people talking, enjoying themselves, is absolutely wonderful. And it was very interesting because first of all we would sit back as sort of observers. We were watching this and just making sure it was all running the way we were hoping, but we were constantly told, sit down, eat, share with us. And I realized that actually we turned the tables, the power dynamic had completely changed. So they were serving us, we were the guests. And it gave them
wonderful.
It is wonderful. There was a woman, we had one this week, and this woman was Albanian, and she had been quite dismissive. She'd been coming to the meals because it was a better alternative than eating in the hotel, but she seemed very unhappy. She never smiled. None of us had ever seen her smile. And I spoke to her last time and said, would you be interested in cooking? And she sort of said, well, I was a chef. I had my own restaurant. So, this is kind of like, this is very inferior to what she was used to doing. And I said, wow, it was a fish restaurant. And I said, if we could get the fish, would you be interested in doing it? So she did this week, and I won't lie, it was a challenge to get the right kind of fish in the right kind of quantities, but we got there. And we got an NHS discount as well when the man heard what we were doing.
Brilliant.
But this woman was beaming all night. She was smiling, this broad smile, and we applauded at the end and thanked her and made a sort of occasion of it. And the food it's always amazing food, but she'd presented it so beautifully. Everything was beautifully arranged and served, and she ran with this as if this was a restaurant evening. And this was hers. And it really made me think that actually this is far more than food. It's far more than nutrition. It's far more than just giving people something to do. This is actually helping people to integrate. It's about social cohesion. It's about respecting people's culture. It's about changing that dynamic where we're the professionals and we're doing everything for people, and shouldn't they be grateful to do this? But actually saying, let's celebrate what you've got to bring and what you can offer. And that we're hoping that by having the certificates, that what we can do is think about employability, so people can, once they've got their asylum decisions, they can go straight out and get a job in a cafe, in a restaurant. And we're preparing little packs with certificates and sort of a CV and something about the community kitchen, so that people can use that for interviews. So that's one of the things. But
that is absolutely incredible. One of the many things you're doing, Lisa. I think in terms of all the things you've talked about, it'd be really interesting to know what you think kind of the top 3 sort of key learning areas that could be taken and carried through in other community nursing settings.
That's hard. I would say the first one is make the most of every opportunity. Every contact that a community nurse has with a client with any vulnerabilities, we need to look at this as a precious opportunity to look more widely. So making the most of those, making every contact count, really. That's what it's all about. The second thing I would say is, don't be afraid to ask difficult questions, because I think sometimes as professionals, particularly if we're thinking of people who are traumatized and have difficulty, it can be almost the fear of opening up a can of worms and not being able to deal with what comes out, that sometimes I think we hold back because of that. But actually, our experience is we need to be very much trauma informed. We need to be very aware that we're not going to be triggering people, but simple human kindness to say, how are you? Are you okay? And to would it be all right if I ask you some questions about your situation? They can say no if they don't want to talk about it, but most times people will respond to that. So I think don't be afraid of asking difficult questions. And I think the other thing is to think about looking after yourself, because it's a little bit like, you know, the old aeroplane thing, put your own oxygen on first. It's really important.
Yeah.
So we do a lot of team building stuff. We're a small team. We're spread out all over Surrey, but we come together virtually every day and talk to each other. But we have an office that's right down near Gatwick, but we cover the whole of Surrey. But we also do a lot of team stuff together. Team events, we celebrate things like birthdays, we go out and have breakfast if somebody's leaving, and we get a lot of psychological supervision and support. So we've got a fabulous psychiatrist who sees us and talks us through the trauma that we absorb, so that we don't carry the burden of that vicarious trauma and get burnt out. So we need to look after ourselves, and I think that that's important for me as a manager. And I would say maybe it's the fourth thing: model the values that you want your team to have, and don't be afraid to be a part of that. So although I'm the manager of this work, I'm very happy to, I constantly pull up my sleeves and get on with the day-to-day clinical work. I don't see that as just within the bands. We're a team, we're all doing this together. Everyone has an important part to play, and I think that's why we value our admin staff and the part that they do in collecting all the data and helping us build the evidence picture about that. So I've given you 4. Sorry about that.
That's right, you snuck another one in. It's amazing. I mean, Lisa, I could speak to you for hours and hours, but thank you so much for your time today. I'm so excited to continue the journey with you and be alongside you and see what comes next. Thank you.
So grateful. Thank you, Jacqui. Take care.